Hello and welcome to the Eating Disorder Therapist podcast. This is a podcast to help you find peace with food and overcome disordered eating. And I'm Harriet Frew, aka the Eating Disorder Therapist, and I'm so excited to share with you all kinds of stories, tips, information and guest interviews to help you on your journey in finding peace with food. So thank you so much for listening today. Now, this episode today is brought to you by the Eating Disorder Therapist Book Club. So if you haven't joined the book club already, do sign up in the show notes. And we are currently reading I Can't Stop Eating by Sarah Dosanjh. If you join the book club, you get 4 extra podcast episodes a month and access to a supportive Facebook group. And it's only £5 or the equivalent of $7 to join. So hope to see you there. Now today I have another guest on the show and I am speaking to Dr. Coker-Ross, who is board certified in preventative medicine and addiction medicine. She presented a TEDxPleasantGrove talk on the Gifts of Intergenerational Trauma in January 2020. And she is the author of 3 books, which are recovery workbooks, including the Food Addiction Recovery Workbook, the Emotional Eating Workbook, and the Binge Eating Disorder and Compulsive Overeating Workbook. And she is a contributing author to the recently released book, Treating Black Women with Eating Disorders, A Clinician's Guide. Now, Dr. Coker-Ross came from a family of business entrepreneurs. Her grandfather was a physician who, because of Jim Crow laws, wasn't able to use the local hospital, so he built his own hospital and with her grandmother started a nursing school to train black nurses. Her mother also was a business owner of multiple businesses. Now, when she went into medicine, Dr. Coker-Ross founded 3 women's centres in San Diego offering general medicine and office gynaecology for women. She was then named San Diego Businesswoman of the Year, and she later went on to do consulting work at eating disorder treatment facilities, where she then founded the Anchor program, and this included developing a line of supplements that were used in her consulting work. The Anchor program is a 12-week online non-diet approach to treating binge eating, food addiction and emotional eating. The program will help you get to the root cause of your food and body image issues, enabling you to make peace with food and your body. So I'm really looking forward to talking to Dr. Coker-Ross today. She has so much expertise, wisdom and knowledge about eating disorders. I'm really looking forward to hearing about her journey and the support and treatment that she pioneers in helping people with healing their relationship with food. Let's get to the interview. Hello, Dr. Coker-Ross, and welcome to the Eating Disorder Therapist podcast.
Thank you. I'm very excited to be with you today.
Oh, thank you so much. So I'd be so pleased. Would you just introduce yourself, please, to the listeners and just tell us a little bit about yourself?
Sure. I'm a medical doctor and I specialize in treating eating disorders, addictions, and trauma. I am, an American, obviously, and the oldest of 5 children in a family that grew up in the South of the United States. And I've been in practice for many, many years now.
Mm-hmm. Okay, well, thank you so much for sharing. And Dr. Coker-Ross as well, I realise actually you come from a family of real entrepreneurs, is that right? It sounds like lots of sort of innovative people and who have done some quite incredible things in your family.
That's absolutely true. I'm very fortunate in that way that I have that legacy, really. And it's always interested me to follow in some of their footsteps and creating some of the things that I've created. I feel like I done the best I could.
Yeah, they're sure. And I can imagine with that, actually, maybe it feels like on the one sense an inspiration, but on the other sense, maybe a pressure as well that you have
an obligation. you have to live up to those expectations. Yeah, I think in particular, my mother's father was, an inspiration for many generations because he was a physician in a small town in Texas, but the only Black physician there at the time. And because he couldn't get on the staff of the local white hospital. He built his own hospital. He and his wife trained their own nurses. They started a nursing school. He actually developed a model for treating people who were sharecroppers and other poor Black families by using what we now call managed care. In other words, he would charge them like 50 cents per person per month. And for that, he would provide full medical care and dental care and so on. So yeah, he was quite a legend, and that was a lot to live up to. But I grew up with him and my grandmother, and they were, I really felt my grandmother was my second mother because she was just such a lovely woman. And I grew up going to his small town office after school every day. And I lived with them for 2 years, every summer, working in the office. And that was my inspiration. He took me on house calls. I saw him deliver a baby. I saw him pronounce somebody who had died. So those are some of my memories that I think led me to go into medicine.
Oh, well, thank you so much for sharing. And it sounds like, some really wonderful memories to have, and sort of just really inspiring people to have in your early life.
Yes.
So Dr. Coker-Ross as well, did you sort of decide sort of early on in your career to sort of specialize in sort of eating disorders, or was it sort of eating disorders and sort of the broader area of mental health and addiction?
No, not really. I actually started out doing general medicine, and I actually went back to the town where my grandfather had practiced and practiced there for a number of years. It's called Bryan College Station in Texas, and then ended up doing a residency in public health and preventive medicine. But no, I actually was mostly seeing just general medicine patients for quite some time. Eventually focused my career on women's medicine, and I developed 3 women's centers in San Diego, California, that offered general medicine for women and office gynaecology. We didn't deliver babies, but we did everything else but. And we didn't do surgery, obviously. So that's where I actually started becoming interested in eating disorders early in my career. I was offered a medical directorship of an inpatient eating disorder program in San Diego. And that kind of hooked me into, that whole field. And then later I trained in addiction medicine and became board certified in addiction medicine. And as you know that I did a TED Talk in January of 2020 on intergenerational trauma. And I talked a little bit about this in my TED Talk, which was that so many of my family members are struggling with the same issues, whether it be eating disorders or definitely addictions and other mental health issues. So that's kind of the second part of what drew me into the field.
Okay, no, interesting. So it sounds like, and were you quite hooked, were you, once you sort of had that role in eating disorders? Did you find that you were just really drawn into it, really sort of interested you and kind of resonated with you?
Yeah, absolutely. I started doing my own program at that time for weight management because that's what, I was trained in medical school, and most medical doctors still are trained in, if someone is living in a larger body, they need to lose weight. And so I never was a diet focused person, but I did try to develop programs that enable people to find their own voice, to change their lifestyle, and to, also become more authentically who they were. As time went on, I shifted my focus far, far away from that kind of approach because I think my patients really taught me that diets really don't work. No matter how good you are at staying on a diet, it's not sustainable. And so pretty quickly on, I think maybe over 20 years ago, I shifted my approach to focusing on working with the trauma that many people with eating disorders have. And also, still with lifestyle changes, but not with the focus on weight loss, more the focus on becoming healthier by changing, you can be healthy at any size you are. Really was an advocate of the health at every size model. As soon as it came out, I felt a strong resonance with that. And I think, really a kind of an activist desire to free women from being so controlled by this desire to be thin, and, noticing how many of my patients were so unhappy because they were not perfect size, and how many women put their lives on hold. I can't do this. I can't find a relationship. I can't fill in the blank until I am thin. And that really sparked something inside of me too, because I've always been very, like I said, I had 3 women's centers. So I've always been very much into advocating for women in their health. So.
Yeah, no, sure. No, thank you for sharing that. And were you working, Dr. Coker-Ross, with women who were more struggling with bulimia and binge eating, or women who were overweight, or was it sort of across the whole spectrum and sort of anorexia as well?
Yes, it was across the whole spectrum. In 2002, I went back to do a fellowship with Dr. Andrew Weil's program in the program in integrative medicine in Tucson, Arizona. And I worked with them for 2 years and studied with them for 2 years. And after that, I obtained a position as the head of an eating disorder program at Sierra Tucson, which is kind of a world-renowned program, and built that program and really worked with every eating disorder along the spectrum. So from anorexia to bulimia to binge eating disorder and so on.
Okay, so right across the spectrum. And it sounds like sort of the program you developed as well, like you say, it sort of started off focusing more on kind of like lifestyle, and you've always been sort of very anti-diet. But as time went on as well, you focused much more on sort of like the trauma and perhaps those deeper psychological issues.
Yes, particularly when I worked in the inpatient treatment centers, I really was exposed to how much trauma there is in this arena, both in addictions and in eating disorders. And around that time, the Adverse Childhood Experience study had come out. And so there was a lot of talk about how that study really shifted perspective, but it took a while for people to kind of really get it. But it was shocking to find that, something that could happen to you in childhood, like abuse or neglect, or even witnessing domestic violence in your home, and that whole list of other things could have an impact not just on your mental health, but on your physical health. And that was a real, I think, pivoting point for me to recognize and to actually start screening more for trauma in my eating disorder and addiction patients.
Sure. Yeah, and it was so helpful, isn't it? Because I think, the more symptom-based approach, I mean, obviously it has its place as part of treatment, but if those underlying issues aren't addressed, it's very difficult, isn't it? I think to fully heal from an eating disorder or another addiction or a mental health problem.
Yeah, I think that's very true. And what we're seeing is, there's such a high relapse rate for eating disorders that, you have to ask yourself, what are we doing wrong? And I know for many generations, patients were being blamed for not doing well. So if you went to a treatment facility and then you relapsed, then it was like, well, it wasn't the fault of the treatment facility. It was your fault, the patient's fault. And I think that's a really erroneous assumption. And we really need to work harder at providing what these patients need who are seriously ill, and finding better ways of helping them to heal. And one of the things that I found makes the most difference is working with patients on trauma.
Yeah, for sure. And I'm so with you with that. I really am. And could you say a little bit more about, with the sort of trauma work, are you using a certain model of therapy, or kind of what does that sort of look like in terms of what the patient might receive within the sort of inpatient unit or within the treatment center?
Well, when I worked in an inpatient unit, particularly when I worked at Sierra Tucson, they no longer have an eating disorder program, but when I was there, they did. And they also had a very strong emphasis on integrative medicine. So I developed probably the first integrative medicine approach to treating eating disorders. And I worked with other providers. We had an acupuncturist, chiropractor, energy healing, plus the usual therapist. We had, dietitians and so on. So we had a whole team that worked together. And that was very, very successful. We always got comments once patients were, discharged to a lower level of care that our patients were farther along in their recovery than maybe some others were. So I think this team approach and this combination of, many treatment centers now say they have an integrative medicine model, but they're basically just offering yoga classes, or maybe they're offering art therapy, which is all good. But I was really proactive in truly integrating what the acupuncturist, for example, was seeing in her evaluation with what we were seeing, so that you could kind of combine, all of the information in a different way. So we would staff the patients together with the integrative providers. And I think they learned a lot and we learned a lot, and it was all for the good of the patients.
Sure. It sounds like a really sort of personalized approach and truly holistic, I guess, and really joined up, which, in a way, it makes so much sense, doesn't it? There would be all those things, but so often I think that does get missed, doesn't it, in treatment?
Yeah, I think it gets missed because, insurances don't cover a lot of those kinds of things. And so because we don't have national health care in the United States, and I don't even know if insurances cover that in the UK, but certainly in the US, people are struggling to find and pay for health care. And so, sending a daughter or son into treatment can bankrupt a family here, and has done on many occasions. So it was a very unique experience, because Sierra Tucson at that time was mostly the treatment center for kind of the rich and famous. So it was movie stars who came, famous singers, famous boxers. We had all kinds of people, but a lot of them were very wealthy, so that we didn't have to really worry about, treating them in this way. And unfortunately, as I moved into the different facilities where insurance was the main way, or some cash pay, but mostly insurance, it made it very difficult to continue to practice at that high level.
Yeah, no, sure. Yeah, no, it's just such a common problem, isn't it? I think that in the UK, we are incredibly fortunate to have our National Health Service. But again, it's kind of limited with resources, and it tends to be the most unwell people that can access that treatment, which often, then still leaves many, many other people that really need and deserve the help but can't access it always.
Yeah, that's what I had understood. So I've talked to people in countries that have national health care, but, and so it's basically the same for people who have insurance here. If you have anorexia, you have to have some medical complication or be severely underweight in order for insurance to pay for extended care or to pay for enough care. So many times, there's you have to get approval for 2 to 3 days at a time, which is so time consuming and counterproductive, really, because we know you're not going to cure anorexia in 2 days, a week, a month, So it's, I think developing and focusing on developing newer models of care is really important. And it's something that I don't see happening a lot. People are just continuing to make money from the old model wherever they can. And families are continuing to struggle. And that's why I actually developed the online program that I have for binge eating and emotional eating and food addiction. the Anchor program is a program that I kind of retooled for telemedicine in 2016, and I've been running it ever since as an online program. It's an online non-diet approach that really focuses on, helping people change their lifestyle, of course, but also identifying and processing, working through some of the issues that they've had from childhood adversity. And that's very satisfying for me because, people aren't having to mortgage their homes to pay for, treatment. I don't know if you guys know, but a 30-day stay for eating disorders can run anywhere from $30,000 to $60,000 in America. So that's not something that most middle-class families certainly can easily handle without insurance,
Yeah, no, sure. So can you tell us a bit more about your program, actually? Like, how long does it last? And is it kind of modules, and how's it presented? Yeah, can you tell us more detail about it, please?
Sure. It does work with modules. So what I wanted to develop, my goal was to be able to do what I do in my office, but to do it with small groups of women. And not to say that I don't like working with men, I really do, but generally, men are less likely to present for treatment, even in an online program. And so having one man and 5 women has not worked out to be the best. So I decided to limit it at this point to women until I can get more men coming in. So it's small groups, 5 or 6 women, all of whom have binge eating, emotional eating, food addiction. We start with an intensive, which is really about helping people start shifting their mindset away from the diet mentality, where it's all about, the number on the scale, using your willpower, gutsing it through, all of those kinds of things that really don't work. And we also educate them about the effects of trauma and help them to start to look at those effects and identify them in their own lives, and help them get to the root cause of why they have struggled with these problems. Many of them have struggled since they were like 5 years old. It's kind of shocking what has happened, because this massive focus on being thin has affected generations of young girls who've been put on diets, who've been bullied, who've been shamed because of their size. And, even by doctors, who are, by the way, the number 2 cause of weight stigma in the United States. So there's a lot of emotional distress that results from all of that, plus the media pressure, peer pressure, etc., to be thin. And that has led to women obsessing about food, being desperate, being willing to take desperate measures to get thin, and so on. So my goal was to shift that and enable them to really understand what it takes to be healthy, no matter what your size is. And so the first 12 weeks is an intensive where we're doing a lot of education and working on mindset and working on helping them become aware of the effects of trauma and so on. And that lasts for 12 weeks. And we meet every week on Zoom, and it's the same group of women. So I know that many people do this kind of thing online, and they have 25 or 30 people in a group. And I really wanted to do that in-depth work, be able to have more impact. So after the 12 weeks, they go into a 6-month program where we meet every 2 weeks. And there's that part of the program is all about accountability and building a structure to live your life with this new approach. So that, we still do a lot of the emotional work, but there's a bigger focus on, learning. I mean, there's so many women. I had a group just on Sunday, and some of the participants talked about how they just didn't even know what they were supposed to eat or what to eat or how to put together a meal because they've been dieting their whole lives. And so we do put a focus on that and on helping them find ways of being more active and so on. So, and after that, after the 6-month program, we then have an alumni group that they can stay in for as long as they want. So the idea is to, give them expert support. I mean, I'm an expert in my field with over 20 years of experience. And I work with 2 registered dietitians who also are experts in eating disorders. But I think both of them work in treatment facilities and both have private practices. And so they've been doing the work for over a decade each. So we have combined, 50 plus years of experience. It's not the same as going to like a Weight Watchers where you're just talking to a counselor who's been through the program. It's a little different than that.
Okay. Well, no, I mean, I think it just sounds such a valuable program, and to have the phased approaches as well of being able to do that kind of deeper intensive work and then progressing more perhaps to kind of, the lifestyle stuff and starting to learn how to eat when you've been dieting for so long. But then also having that kind of longer term, like I love the idea that you've got this alumni group as well, because I think it really is an ongoing process, isn't it? When you've been sort of dieting for so many years, just wonderful to have that ongoing support.
Exactly. I mean, I was very fortunate when I had my practice in Denver that I worked with the same group of women for 5 years. And we went through this program and they repeated the program. At that time, it was only like a 12-week program, and we just repeated it. And then I added sessions, but it was the same group of women with these problems for 5 years. And it really gave me perspective on how long it does take to make permanent changes. I know in preventive medicine, the studies show that it's 3 to 5 years to make a permanent lifestyle change, whether it be stopping smoking or changing your eating habits or whatever, lowering your cholesterol. All of those things take time. And I think our diet culture has convinced many people that, oh no, you can do that in, 3 months, just go on the fill in the blank fad diet for 3 months and then your whole life will change. Well, it won't change because the weight is not the problem. The eating issues are the solution to the problem of what happens to women growing up who have had some kind of trauma or childhood adversity. So the eating is a survival, strategy or coping strategy for people who've experienced trauma, just as for many people with addictions, the same holds true. So when we focus on, just change your eating or just change the number on the scale, you're really just treating the symptoms instead of treating the real problem.
Yeah, no, I'm so with you. And I think it just, by focusing on the number on the scales, just by focusing on the eating, it just sort of perpetuates the problem, doesn't it? And people feel so ashamed that they can't just do it in 3 months, which of course, is so understandable. If this is like a kind of life raft or a kind of coping strategy, it's going to take a bit of time to be able to work on this.
And maybe they can lose weight in 3 months, but then they aren't able to keep it off because they have no way of dealing with those effects of trauma, which causes anxiety, depression. It can, cause a lot of difficulties in just regulating your emotions. And that's one of the triggers for people to binge eat, for example.
Yeah, no, I think such a good point. And is your program available to people worldwide, or is it just in the United States?
No, actually, I've had a number of international people in the program. Obviously, it's all in English, but I've had a lot of people from Canada. I've had people from the UK. I've even had someone from Dubai who was in one of the early groups. So, yeah, it is available worldwide. And I love working with people from around the world because it reinforces that, this problem it's not an American problem. It's really a global problem, at least for the developed countries, the more wealthy nations. This is an ongoing issue that's often not addressed And people are continually told, just lose weight, just lose weight. What's your problem? Just lose weight. Why can't you just lose weight? And it's just unfair. And unfortunately, medicine has no tools really that are effective in helping people lose weight. So you're essentially on your own. If that were the solution, you would think that in medicine, we would have developed some ways to help people do that. But I don't think it is the solution. And I just feel sad that so many women have been, punished both within their families and within the broader society for being in larger bodies.
Could you say a bit more, Dr. Coker-Ross, about the health at every size model, please? So I think, I know quite a lot of the listeners are aware of that, but I just think it'd be really valuable just to hear a bit about that in a bit more detail.
Yes, I believe it started in about 2008 or so. Lindo Bacon was one of the originators. And when she came out with her book, Health at Every Size, and I read that book, I just thought, finally, this is what we've been needing. And she started from a point of the science, which I think is really important, that she's and her partner, looked over. I'm sorry, I should change the gender for her because she has gone through transition. So I'll go back and say Lindo Bacon. And he is the one who went through the research and actually identified the fact that the research was biased because it was based on the assumption that, being in a larger body by itself, by its very nature, is unhealthy. And we don't really know that, but that's what the scientists, that's what the doctors assumed. And therefore, all of the information that came out of that is really biased. Another person who I think was really pivotal in highlighting this is the woman who wrote the book, Secrets of the Eating Lab, blocking on her name right now. But she is a researcher at a university here in the United States. And she also went through in great detail all of the different, Tracy Mann is her name. And she went through all of the research and analyzed the results. And really, you come away from reading her book realizing that weight is not as big a factor as it's in health as it's been made out to be. There is some small amount of effect in the highest weight range, but it's not as dramatic as you would think, or as we've been led to believe. And so when you look at those studies, it begs the question of why are we making such a big deal about this? Why are we ruining, little girls' lives, women's lives by telling them this is the only way you can be healthy? And so I think when Lindo came out with her book, it really gave me more impetus to go in that direction 100% and, realize that we really need to take weight off the table and really help women understand how to, live in their bodies, how to get rid of that diet mentality and how to be able to express themselves authentically and learn how to manage the emotions the emotional dysregulation that's a result of all of the trauma that they've experienced.
Yeah. And I think it's so challenging, isn't it? I think just challenging the diet mentality, because it's almost like we're sort of indoctrinated with it, aren't we, from birth, really? And often on an unconscious level, it's just become so normal. And I know, there's such a lot of great work going on these days where people are really challenging it. There's lots of great accounts on social media. I think the tide is slowly turning, but it's just still got a long way to go, hasn't it?
It has a long way to go. And I think particularly given that the medical profession is still promoting weight loss as the only way to be healthy. And that's where it's very, very difficult for someone who goes to their doctor who they trust and need help from for whatever reason, and to be told this information as if it's a fact when in point it's not. And that's, I think, the part that hasn't changed very much. There are just still so many physicians who are now on social media talking about, there's a new term for what they're doing, which is called healthism, which is basically saying you can't be healthy unless you lose weight. It's no different than the other message, but they're making it all about health now instead of other, like you won't be happy, or you can't get a man, or, you won't look good, or people won't like you, or you won't get the job, all of the other discriminatory practices. So, and I think that's now starting to, also affect women of color. As you know, I have a chapter in the book that was released earlier last year called Treating Black Women with Eating Disorders. And it's a seminal book because there's really nothing out there that talks about, the full picture of treating women of color who have eating disorders, and the number of eating disorders is the same, no matter what your color. But Black women have not been getting diagnosed. It's, there are a lot of misconceptions and partially some of them are true, in that in the Black community, there is probably more acceptance of a fuller figure. But I think the more acculturated the Black women are, whether they be from the Caribbean or from Africa or from other places besides the United States, and even in the United States, the more a Black woman identifies with this thin ideal, the more likely they are to have eating disorder issues, serious eating disorder issues.
Sure. And so what are some of the sort of main differences, I guess, in terms of maybe, just addressing and treating eating disorders for Black women? Are there any sort of particular issues that really kind of come up?
Yeah, I think there are a number of issues, and maybe your listeners may not know, but I think one of the biggest issues is the extra burden of race-based trauma that Black women experience on a day-to-day basis. And that has, the other part of that is that most therapists aren't trained in cultural competence. And so, for example, within treatment centers, there may be conflicts between patients, or, between white and Black patients. There may be feeling of lack of understanding of the staff by the patients, feeling like they're not understood. But every day a Black woman goes out into the world, she can experience microaggressions and outright racism in any country that she lives in. I mean, I know it's bad in the United States, and, everybody has known what happened after George Floyd's murder, but his murder sparked protests in 70 countries and on all 7 continents. So it's not just here that we have it. And I know I've spoken in Canada, and there's a strong resistance to thinking that, Canadians have any racial bias, but you can't help but have racial bias. We're all swimming in it. If you've been either a colonizer, or you live in a country that has been colonized, those beliefs came to the fore, and particularly in countries where slavery existed. And obviously the United States and Caribbean and so on. The United States had probably the longest stint of slavery. And then after the post-slavery era was rife with what we call the Jim Crow laws, which were anti-Black laws, racist laws. You can't drink at this water fountain. You can't sit anywhere on the bus. You have to sit in the back of the bus. You can't go to school with white children. You can only go to Black schools. And I grew up, that was still existing when I grew up. So that has continued, and obviously more so, it's been highlighted. The use of the police back to slave days is where that started. And this notion that, Black men are dangerous, even if they're only 14 or 12 or, young, as many of them have, and even if they haven't done anything wrong. And we see that police bias in numerous countries. I've researched it in the UK, I've looked at it in Canada, and obviously in the United States, that Black men are more likely to be incarcerated for the same crimes that whites commit and so on. So I think you can't, if you're a white therapist, you really have to educate yourself about the issues that your Black patients may be facing. And also to recognize that, the African diaspora is very diverse. You have many people in the UK from, I don't know, where most of the Black people come from in the UK. You have to tell me, but.
Oh gosh, do you know, I don't even.
Africa, probably the same as here. Because I know we have Afro-Caribbeans, we have Caribbeans who are Black and brown, we have Puerto Ricans, it's et cetera. So we have a lot of both Latinx and Black diaspora is very diverse. And so you can't assume, most people look at me and don't think I'm Black, and yet I am. And I experienced a lot of that same kind of racial trauma growing up, and that I talked about in the TEDx talk that I did, TEDxPleasantGrove talk that I did.
And what's the name of the book, Dr. Coker-Ross, if people want to get hold of the book?
I believe it's called Treating Black Women with Eating Disorders.
Okay, because I'll definitely make sure that we put that in the show notes, because I'm sure there'll be a lot of people that will be interested to read more about that. And could you just say as well a little bit, as you've mentioned your TED talk a couple of times, but could you just say a little bit more about that as well? Because I think it sounds really, really interesting.
Yes, the TED talk is about intergenerational trauma. And I wanted to do that TED talk to talk about how trauma can be passed from one generation to another in families, and how important it is for families, not just individuals, but family systems, to recognize the trauma that maybe granddad had in the war, in Vietnam War, or dad had going to Afghanistan. And, there's all sorts of trauma, including, maybe granddad had alcohol use disorder, and then the effect of that was he was a raging alcoholic, and that affected his children. And then they passed that effect on to their children. So, there's a lot more studies now on intergenerational trauma. It started back in the 1960s with looking at the offspring of Holocaust survivors and how high their PTSD risk was if their parents had been also diagnosed with PTSD. And there were a lot of other characteristics that were being identified in offspring of Holocaust survivors who themselves didn't experience trauma. And many of them lived in families where the Holocaust was never talked about. And yet and still they had these trauma effects. So, in my own family, as I mentioned earlier, and when I did a family tree, we can trace our roots back to slavery on my mother's side and back to, free slave historic colonies or communities on my dad's side, because he was from the North. And then you start to notice, the drug addiction, the mental illness, the suicides, the people who have eating disorders. And in every generation, we have lost at least one child to mental illness or to addiction or to one of those other things I mentioned. And it just became very evident to me over time that, that these traumas were intergenerational. And I started working within my own family to help them become more aware of that and to help them, in parenting their children and me in parenting my children, to get help for some of the things that we were seeing, to see if we could, interrupt this intergenerational trend.
Gosh, so fascinating, isn't it? And I think just how helpful to have that broader insight into that intergenerational trauma, because I think, we do often treat the person, don't we, in isolation, not taking into account all of the history. Yeah, and I think, Dr. Coker-Ross, I'm just amazed actually as well by how much. You've obviously done so much work out in the world, but also you have brought that back within your own family. And I think as well that can be incredibly challenging work, I think, sometimes, can't it? Bring it home.
Oh, believe me, when I sent out the adverse childhood experiences quiz to my nieces and nephews, I'm sure many of them were like, "Oh my God, here we go with Aunt Pat again," But, you can only do what you can do. And the ones who have been interested, I've continued to stay in contact with and have conversations with. And it's just about opening the conversation up. If nothing more happens, at least people are becoming more aware, for sure.
Yeah, that's very true. So, Dr. Coker-Ross, do you have anything sort of coming up that you wanted to promote or mention, or any other sort of exciting developments in the pipeline?
Well, I've been doing a lot more anti-racism consulting work, particularly with treatment centers, but also with other mental health facilities and even the public defenders in one city in Arizona and so on. So the consulting work is kind of came out of the protest of the previous year and out of my speaking that I've been doing for like 4 or 5 years on treating Black women with eating disorders. And so that's something I'm really excited about. The Anchor program I mentioned to you, I'm really continue to get so much satisfaction and to feel it's such a valuable program for people to be involved in. And other than that, I am offering for podcast listeners a free copy of my book, the Food Addiction Recovery Workbook. So I'd be happy to provide that link for you. And we are shipping internationally. I pay for the book, but you have to pay for the shipping. So we found the shipping is fairly reasonable to Europe and the EU. In the UK, a little bit harder to do shipping we found to Australia, for example, because of some of the rules that they put into place now. But those are the things coming up for me. I speak at conferences all over the world and continue to love to do that virtually now because of COVID and to be on podcasts like this one.
Okay, well, wonderful. Thank you. Well, I'm sure lots of people will be interested in the book. That's just a real gift. Thank you.
You're welcome.
And where can people, if they want to find more about the Anchor program or just about you in general, where are the sort of best places to find you sort of on the web?
Yeah, the best place is at my website, CarolynRossMD.com. That's CarolynRossMD.com. There's my podcast on there. There's information about the Anchor program. You can see my TEDx talk there. So pretty much everything is there. The Anchor program also has a separate, more detailed website, and that's just anchorprogram.com.
Okay, lovely. Well, I'll make sure all those details go in the show notes. Okay. Well, I just want to thank you so much for coming on the podcast today. I think so many just really interesting topics and points of discussion, and it's just such valuable content for the listeners. So thank you very much.
You're very welcome, Harriet. It's been a pleasure to talk with you today.
So I hope you enjoyed this conversation just as much as I did. Do go and check out all of Dr. Coker-Ross's details in the show notes. If you're not following me already, do seek me out on Instagram at the Eating Disorder Therapist. And for further support with your relationship with food, do go to the eatingdisordertherapist.co.uk. If you'd like to join the book club, details are in the show notes. If you click on the link, it will take you through. And if you enjoyed this episode, I'd be so grateful if you would follow, rate and review, as it helps it reach so many more listeners. Thank you so much for listening today, and I look forward to sharing another podcast episode with you very soon.